Welcome back here to Fox 51 today. You know, there's so many amazing things happening in the medical field here in East Texas, especially at Trinity Mother Frances Hospital. We're joined now by Dr. James Caccitolo. Doctor there, James, thank you very much for joining us. We really appreciate it. There's a remarkable thing happening at the Lewis and Peaches Owen Heart Hospital, and that is the fact that you guys stand in the top 15% in this country in U.S. heart surgery outcomes, and that's extremely impressive when it seems like heart surgeries are just occurring more and more, unfortunately, in this country.
Yeah, that's true. Over the last several years, we've participated in a national database administered by the Society for Thoracic Surgery, where we submit all of our data on all cardiac procedures performed at the Lewis and Peaches Owen Heart Hospital. And quarterly, we receive reports back to help us monitor our quality and outcomes for cardiac surgery. Twice a year, we get a star rating. The star rating is a 3-star system, 1 star being the lowest, 3 being the highest quality programs. And fortunately for this last data harvest, which includes data from July of 2010 through June 2011, we received that 3-star or highest quality rating.
Now, Doctor, a lot of people might say, well, gosh, those numbers are great, but if you're not in the medical field, they're thinking, what do those statistics mean to me?
Well, what it means to a patient is that if they have surgery at the Lewis and Peaches Owen Heart Hospital, they'll be receiving some of the highest quality of care available to them undergoing heart surgery. And that's on a national schedule or ranking, so they can be assured that if they have surgery there, they'll be receiving that high level of care.
Doctor, tell us how this data is collected, and is some of it voluntary?
It is. Participation in the database is voluntary. It's collected retrospectively, which means after patients are discharged from the hospital, their medical records are surveyed by a nurse who extracts the data and then submits it to the database where it's analyzed.
So I guess this might sound like an elementary question, but should patients look to this data to help them make a decision on where to get their heart surgery?
Well, it's just another piece of information that patients can use. The data is available on a website, both through Consumer Reports as well as the STS website. There's a link to it on our website, tmfheart.org. And of course, we always recommend patients speak with their primary doctor when selecting a hospital, but certainly it's another piece of information available for somebody who might need heart surgery.
Well, doctor, it seems like the healthcare industry continues to become more and more complex for a lot of patients. This just seems to me like more information, these STS rankings, that can really help them decide, you know, when and where to go to perform a heart surgery.
Absolutely, it does, and again, it gives patients reassurance that if they choose to have surgery here in Tyler, they're going to be having an operation and post-operative care plan that really is highest quality available. Dr.
James Caccitolo, thank you very much for joining us this morning. We really appreciate it. Thank you very much from the Lewis and Peaches Owen Heart Hospital here in Tyler.